Roseland Community Hospital president and CEO has been fighting all political forces to keep the doors of our safety net hospital open since 2013. Today, during the biggest threat to Medicaid in our country's history, we need Egan's true grit more than ever.
I don't have the time, the energy, or the inclination to explain why politics goes hand in hand with safety net hospitals.
Tim Egan led the fight against Republican Governor Bruce Rauner in 2015 and has overcome critics and death threats and is now standing up against Donald Trump.
What we're hearing out of the White House at this point in time is death and destruction for safety net hospitals.
Trump's big ugly bill has threatened to destroy Medicaid and cut $55 billion in funding over the next decade. But Tim Egan is pleading with the Illinois legislature to bolster safety net hospitals until the threatened death and destruction can be rolled back through political action.
But politics from D.C. hasn't touched us yet.
Aside from the lingering big ugly bill impact, safety net hospitals are facing immediate threats of reduced funding and community-destroying ideas such as freestanding emergency rooms.
Freestanding emergency centers do not provide the full range of services that hospitals do. They do not run inpatient units. They do not sustain trauma care, behavioral health, or other essential services that communities like ours depend on. Safety net hospitals cannot turn patients away. We treat everyone regardless of their ability to pay. Freestanding emergency centers are not a neutral addition to the healthcare system. They are a step toward replacing full-service hospitals with limited, profit-driven alternatives.
The lives of the patients we treat are now in the hands of the Illinois legislature, and we cannot afford bad politics to lead to bad policies and closure of our safety net hospitals.